Joining us now from Capitol Hill, New Jersey Senator Bob Menendez, who is also chairman of the Democratic Senatorial Campaign Committee, so he'll be needing to answer those charges. What will you say, Senator Menendez? What will you have your members say to those who suggest using reconciliation as an end run when you don't have the 60 votes is somehow illegitimate and thwarts the will of the people?
Well, Savannah, first of all, what we'll say is that we're talking about a simple majority vote. That's what reconciliation is, and it can only be done for budget elements. But more importantly, what we'll say is, look, no matter how hard we tried, no matter how hard the president tried, Republicans just weren't serious about solving the problems of millions of Americans who get denied health insurance because they have a pre-existing condition, of tens of millions of Americans who have no insurance whatsoever, and of all the rest of us who have insurance and the price keeps going up, even though we get denied more and more when we make a claim with our insurance companies. These are all the things that are going to be taken care of in health care reform, and we think that's far more compelling than some process argument.
Senator, you are sort of the chief campaign therapist sometimes for some of these incumbent senators who are nervous about running for re-election this year when it comes to having to answer to this charge. So what are you telling a wavering senator who's thinking about whether to even participate in this process or not? What is your case to them that says, you know what, I can promise you this will be better for you in November if you do this, not worse?
Well, Chuck, what I say is, look, if we don't pass health care reform, number one, we will have lost a tremendous opportunity to do right by millions of Americans, both who have insurance and get denied by their insurance companies when they make a claim, and for millions who get denied trying to get insurance, and for many millions who don't have insurance because they can't afford it. Secondly, that's a compelling argument to go back. In every poll before these elections, we heard health care is the number 2 issue. Number 2 is that if, in fact, you don't pass it, every boogeyman that they said existed under the bill, which is untrue, like death panels, they'll be able to continue to perpetuate those falsehoods. When you pass the bill and some of the immediate benefits take place and people see that all those things they said were not true, it's not a government takeover of health care, it's private insurance competing for each other for 35 million new insurers with a lot of limitations so that they can't do these abuses against consumers, that's a powerful argument. And after all, reconciliation was used by Republicans to the extent that it's ever been used more times than Democrats ever have.
Senator, I know you have to go quickly. Arkansas Senate, Blanche Lincoln, we know her Democratic opponent already has raised over $1 million, is already on TV. Is the DSCC going to spend money on behalf to defeat her primary challenger?
Well, Chuck, we always support our incumbents. We are with Blanche Lincoln, who is chair of the Agriculture Committee in a state that has 25% of GDP in Arkansas of agriculture, should really want to see Blanche Lincoln stay. And of course, we never broadcast what we're going to do in terms of our strategy to help our incumbents.
All right. And do you believe Bill Halter can win the general election or no?
I believe that Blanche Lincoln would be our best candidate in the general election to defeat whoever the Republicans are in that primary.
Senator Menendez, we know we have to let you go. Thanks very much for joining us.
I have nothing else.